I have this pair of jeans which has kind of gotten a bit old and it is kind of ripped off. This is easy to fix. Take a needle thread, go to a tailor, fix it. Worst case scenario, you can just throw it and get a new one. And believe me, this jeans is a lot younger than me. If this happened to your own genes, I mean the genes in your body, how do you fix it? You, me, everyone is born with genes which could be good or which could be bad. Good ones are great, but we are born with the bad ones. You don't have a choice. So the question is, how would you fix them? How would you suppress them? Well, let us find out in this video how to fix bad genes and have a healthy lifestyle. Also, we will find out how this is relevant to blood health, especially things like anemia and blood cancers or leukemia. For those of you who are new, I'm Dr. Rajiv Iyer, tuning in from New Jersey in USA. This is our live Week in Ask the Doctor session. We are so fortunate today to have Dr. Prakash Vishnu. I have to welcome him. Dr. Prakash, welcome.
Thank you, Dr. Iyer. Hello, everybody.
So, Dr. Prakash is an attending physician and consultant in hematology oncology in Seattle in USA. So Dr. Prakash has taken out his valuable time to spend with us today to educate us. It is a Saturday morning and it is 6:30 a.m. for him, and I can't thank him enough to be on so early to educate us. Maybe he knows I have some bad genes that I need to get fixed. Keep listening. He has some beautiful tips. Well, in our live session, I share very exciting things about our experts. So there are two things I want to share. So Dr. Prakash and I went to the same medical school, Bangalore Medical College, from where we are alumni of. And number two, Dr. Prakash is an excellent singer, he's an excellent cook, he does a lot of extracurricular activities, and he's an expert in everything. How nice is that?
Um, well, Raj, thank you for having me on the program, and thank you for the kind introduction. Um, it all lies in the eyes of the beholder, and it's been great to have some extracurricular activities beyond taking care of patients and practicing medicine and the wonderful journey. Excellent topic today, talking about genes, health, and blood.
We are so excited to hear that. So before we get too far, I just want to quickly show a disclaimer. So you can always find this disclaimer in the description below. And I want to remind you to post your questions in the comments below. And if you would like to join live, just use the link in the description below and you can join us using any device, using a phone too. Also, check out other videos in the channel. If this type of content provides value to you, do like, share, and subscribe to the channel for more content like this. Without further ado, let's get to Dr. Prakash. So we were talking about genes, right? It's so important to know you might be wearing genes right from many years or you may just be starting out, but it's still important to know how to wear jeans, right? Similarly, what is the connection between genes and the body genes, which sound so similar to each other?
So genes is something that we are born with, something that we cannot pick or choose, and it's very intriguing. If you go on to the next slide, there's a slide which talks about the connection between the blood, the genes, and health. As you can see, genes are the ones that leads to subsistence of life. That's the one that carries on life, and the health depends on those genes, and the health is the sustenance of life. And the genes and health carry on from what we call as the blood, the substance of life. So there is that substance of life that will lead to the sustenance by the substance of the gene. So it's genes is fundamental for anything that happens to an individual, and there are many environmental factors which influence how these genes function, which I think is something that we'll talk about as we go along in this program today. Now, interesting connection that you showed between the genes and the genes. They're homonyms. They sound similar, but maybe we can use that as an analogy. We in a fashion statement we have different kinds of jeans that we wear, and maybe we'll use that as an analogy to see how to wear our jeans.
Yeah, no, that's great. So interestingly, I did not know there are so many types of genes. I'm sure there are many more types of genes. So here are some different types of genes. So how can we use your genes as an example to kind of stay healthy? So let's go to this uh, thing that says which genes do you wear. You see this? There are so many types of genes. So
Go ahead. Go ahead.
no, I was about to say how can we use this analogy? So
So we have, several thousands of genes in our body. It could be 10,000 active genes for every protein and everything that our body is structured. And to put them into perspective, if you look at the slide, you have the straight genes, you have the low raised genes, you have flared genes, we have bootcut genes, relaxed genes, overalls. And kind of using this as an analogy, something that has to be straight, something that we have to do low, something that we have to raise, something that we have to flare in our genes, something we have to have add flare to our body, something that we need to be booting all the time, something that we need to relax, something that we should be doing overall to make these genes more functional. So that's how the analogy between the genes and then the wearing genes come into picture.
hmm
Something that when I educate patients, when I talk about the importance of genes, I kind of use this as an analogy for education and patients, and people like the similarity between those. We don't wear all the genes all the time, but we can still modulate and use them. We can kind of train to use them in a specific how we wear our genes.
hmm So walk us through each genes. Let's say let's start with the first one, straight leg genes. So how does it relate to health?
So something that when you have a symptom, or when something doesn't sound right about your health, head straight to your physician's office. Stay on top of your health. You should get regular complete physical exams. Here in the United States, the recommendation is at least once a year. Around the world, depending on the availability, it could be once a year, once every 2 years. But when you have some symptoms which are concerning, do stay on top of those symptoms. Talk to your physicians. There are certain recommendations for screening tests which have shown to detect diseases early on and definitely shown to save lives. For example, colonoscopy at age-appropriate times, getting mammograms, getting your blood test at least annually or once every 2 years, um, testing your kidney functions, testing your blood glucose levels, testing your cholesterol levels. All these things, keep them straight, keep them regular, and that's how you can make sure you can stay healthy.
hmm That's great. So there are so many different types, right? So let's go to low rise genes. So what does that mean by low rise genes?
So low rise, low and rise. Um, Keep your weight in very close to the ideal body weight. Easier said than done, but not impossible. I think most of us in the current day and age are aware how important it is to maintain a weight which is close to what your healthy weight should be. The goal should be not more than 20 pounds outside of your healthy weight. Particularly pay attention to belly fat, which is harmful. Try to keep it as low as possible. So lower your weight, your weight. That's something very important to stay healthy. And raise, it's a challenge. It's not something that could be easily done. I think one of your earlier programs had very nice tips about how to maintain healthy weight. So low raise genes, keep your weight low, rise to the challenge of maintaining a healthy weight.
Yeah, I think you very rightly said it, Prakash, that it's not easy to maintain weight, but you have maintained a good weight. You look pretty fit. So what do you do?
um, it is raising up to the challenge, Raj. Well, some of the things that you mentioned early, having some activities outside of work, trying to find some time of the day or a few hours of the week to go out. Lucky that we are in a beautiful part of the country in Seattle where we have a lot of opportunities to be outdoor. I like bicycling. I bicycle at least once a week, um, and we have beautiful landscape here, hiking. So we, as a family, involve ourselves in going out and hiking. And I think as we get older, it becomes more important that we watch both our diet and physical activity,
Hmm.
which I should say I'm fortunate have the time to do it. So yes, it's right. You're right. It's a challenge. We need to constantly pay attention to it. And you apparently also seem to be doing a fantastic job yourself, Raj.
Thank you. Well, in terms of physical activity, what would be the simplest thing that anybody can do at any age? Do you think it's running, walking, lifting weights? So, what do you think?
Um, any of those things would be helpful. It's just finding your interest in something. Anything. There is no specific exercise diet, exercise prescription as such. The current day and age, we are in front of the computer for the most part. We work long hours. Some of us start as early as 7 in the a.m., may not come back until 7 or 8, and it's really hard to push ourselves to do that extra outside of our regular life, the responsibilities of people who have kids and other obligations in life. But the studies have shown that just 30 minutes of some form of activity, walking, um,
Hmm.
running or bicycling or doing some light weights, just being on your feet and moving around. And there was a study just within the last few days. I saw that 30 seconds of activity during your workday, just taking 30 seconds on the hour or every 2 hours and trying to just move around a little bit reduces reduce the risk of weight gain and other health issues that accompany. So there is no specific cookbook for what is the right activity and what's the duration that one needs to follow. As much as you can. Personally, I would say we probably spend about 5 hours a week, I think, focused on some kind of physical activity, trying to circle different things, bicycling to running to walking,
Hmm.
some light weights. So there is no specific prescription, but it's important to make some voluntary effort uh, to do some physical activity.
Yeah, yeah, no, that's great. I have to remind people that walking is actually the most underappreciated exercise. If people cannot do anything, just get out of the house and start walking.
Absolutely, absolutely.
All right, next, moving on to your jeans analogy. So let's see this bell bottom, the 1970s, which is technically called flared leg jeans. So, what do you
Yes,
want to say
yeah.
about this?
It's interesting. It was a fashion statement back in the 60s and 70s. I think some of these styles are coming back again. I have a young daughter who keeps talking to me about these things and how interested younger kids and the current generation are about the old styles. So flare, and flare. Again, you see two homonyms there, two similar sounding words. This is about diet. Add flair and flair to your diet. Go natural, go colorful. I would suggest, one of the things, again, I think this is probably a repetition of some of the things that's been discussed before in your program. Add natural fruits and vegetables to every meal as much as possible. Use nuts and seeds, which are very rich in antioxidants and nutrition, to salads. Legumes, lentils and certain ground-based vegetables for soups and stews. They are very healthy. Choose whole grain lean people who eat meat choose lean meat and fish, which are very healthy and nutritious. Of course, we're not going to go into some of the other intricate details of what's the right kind of meat and fish. But anyway, flair is about watching your diet, making an effort to incorporate the things that we just mentioned into your diet on a regular basis, at least 5 to 6 times, 5 to 6 days a week.
Hmm. No, you're right. We have said some of these things before, but we want to, keep repeating some of these important concepts to people. So if they come back to watch this, so they hear this again and again, because we want everybody to be happy and healthy, no matter what part of the world you're in.
I think that happy and healthy, those go hand in hand so well. You cannot be happy without having a good health, and that's very true.
Right, right. So what do you want to say about this bootcut jeans?
Bootcut jeans. People, I've noticed these days, people take some time off from their busy schedules, maybe a week, maybe 2 weeks or something to go away from their regular activities. They call it boot camps. And those are, sometimes in nice activities. For example, they take a week off to go hiking, or they take a week off to go to some yoga camps, meditation camps, and all those things. That's one way of thinking about the boot cut or the boot camp, and something that we really have to make a very strong effort. It's like participating in a boot camp. One thing that you mentioned, getting moving, and then certain other habits like smoking. It's so addictive and very hard to get by. Reducing the alcohol intake. The boot cut is something that requires more than just a regular effort. I think we all have come across people, as patients are, as family or friends, who have struggled with these issues. So that's something I counsel regularly to my patients, to how to overcome these habits which lead to better health. So the main things I would like to highlight is, stopping smoking and reducing the alcohol intake.
So when you talk to your patients using this jeans analogy, like the wearing jeans analogy, so how do they receive it? Do they get it better, or so? What's their reaction?
There's certain um, it's they like the analogy. It's something that's easy to understand. Something that we wear jeans regularly, right? And it's we kind of pick and choose, try to find the right fit. um, the genes are something that we're given, as we are born with these, but something that constantly gets influenced and has a role in their health. So when you use that analogy, they do see some similarities. I think they have a better understanding of how can they take a little bit of control or modify how the genes function.
Hmm. So I think quickly let's talk about relaxed genes, and then we can move on to something else.
Yeah, exactly. Probably the last one, or maybe the overall. So relaxed, easier said than done. Again, there are plenty of studies, particularly in the last decade or so, which have shown how there is a very close association between, if you go to the previous slide, talking about relaxing um, and reducing stress. Meditation, I think many of us have noticed that it does help calming us down, and reading is another great habit which will actually help us relax and take away our minds away from the stress. So reading a book, these days Google and search tools like Bing have become the main source of reading. But I would suggest, if you can avoid those and actually get hold of a book and read, that's much more relaxing and reducing the stress. So something to be practiced, and make it a habit.
Hmm. Okay. So let's move on to the concept of anemia. So I have to tell you, being a doctor, uh, although not as great as you, when my child had Anemia, I did not know that. So we actually had a blood test done for a different reason and then found that the hemoglobin was like 8 or so, which was mainly iron deficiency anemia, diet related. Uh, so we got it fixed. So the question is, so first let me show there are so many different types of anemias, right? So
That's very
this is an image from
ab-
Pinterest that I found that I'm showing right now. There are so many different types of anemias. So what is the commonest? Is it iron deficiency anemia?
that's a great point, and the slide that you had just put, Raj, it highlights the fact. So for me, as a hematologist, anemia, I look at anemia more as a symptom rather than a disease because, say, fever, right? For example, fever can be due to many, many different reasons. It could be an infection, it could be allergy, it could be medications. There are many, many different reasons for fever. So is anemia. When somebody comes in with anemia, it's actually reducing the level of their hemoglobin or hematocrit, and it's my role to be a little more investigative of what could be the underlying cause of anemia, which actually leads to the actual diagnosis.
Hmm.
Now, here's a slide. This slide actually highlights, there are hundreds of reasons of why somebody can become anemic. It could be our immune system destroying the stem cells or the red blood cells or the platelets, what we sometimes call as the aplastic anemia affecting the stem cells. It could be hemolytic anemia, hemo blood lysis breakdown. So that's mostly immune mediated. As we have older patients in our population, our practice, we see that they have higher incidence of gastrointestinal bleeding. It could be a polyp. It could be vascular malformations in the intestinal tract. It could be a cancer. So gastrointestinal bleeding. And in younger women, they may have heavy menstrual bleeding. That's another common cause for anemia. And rarely people can have, as we were talking about the genes earlier, people can have genetic abnormalities too. For example, sickle cell disease, thalassemias, and even rare varieties, which can lead to hemoglobin, production of hemoglobin abnormalities, which can lead to anemia. Now, coming back to your question, what's the most common type of anemia? I think it's more regionally dependent. If you look globally, I think iron deficiency stands as one of the common reasons for anemia. Here in the United States, there are, it's a mix of different kinds of anemias. Nutritional anemias are relatively less frequent in the United States unless people are strictly vegetarian and have less amount of dietary iron intake or other B12, other nutritional aspects in their diet. Um, GI bleeding is something that we see very frequently. Heavy menstrual bleeding causing anemia is another most common thing. In my practice, seeing mostly towards the 60 plus age group, myelodysplastic syndromes, cancers, lymphomas, multiple myelomas. It's a long list of causes of anemia.
Okay. So in briefly, uh, how can people know they have iron deficiency anemia and what can they do to prevent it and treat it?
So the symptoms of anemia are, even though there are so many different types of anemias, the causes for anemia, some of the symptoms are fairly common across the spectrum. Fatigue is the number one symptom that most people with anemia have. So another interesting thing, if our body slowly, has a reduction in the level of hemoglobin, I think the symptoms are not as ominous. They're not very obvious. They wouldn't really notice that until it goes below a critical level. For example, as you're mentioning, your daughter, she may not have had any symptoms for a while until you saw her becoming pale, or maybe she would have some vague symptoms which we may not really attribute it to anemia. Despite physicians, we might not be able to pick them up immediately if it's a slow and an ongoing process. Now,
Hmm.
on the other hand, if somebody has a quick drop in hemoglobin, for example, somebody had a significant bleeding episode, they're in a trauma, or accident or had a surgery where they lost some blood, and the hemoglobin levels, which are normally around say 13 or 14, drops quickly to 11 or 10. That sudden shift in hemoglobin can cause symptoms more quickly.
Mm-hmm.
And fatigue is probably the most common symptom. Iron deficiency, if you talk about iron deficiency in particular, they have variety of symptoms. They can have headaches, lack of concentration. I've had patients who have complained of thinning of hair. I think we have read in books, less commonly seen, but I have come across people who complain of craving for ice, craving for dirt, craving for sour foods, and different symptoms, restless leg syndrome, mood irritability, so different nail changes, flattening of the nails, skin fragility, different. It's a spectrum of different symptoms, but that's one of the things I pointed out earlier. When you feel something's unusual, it's always a good idea to seek some advice from your physician or somebody you trust about your health.
Mm-hmm. So, we started by saying there are so many different types of anemia. Obviously, we don't have time to cover all of those, but, briefly, I think we should talk about some of the important things like sickle cell anemia, which is so common in the US and also India and many parts of the world. So, what do you want to say about sickle cell? How can people know they have sickle cell anemia or sickle cell disease unless they have symptoms?
Yes, certainly. Sickle cell anemia. It's an interesting area, both in terms of taking care of patients and also research. A lot of things have happened in the last decade, or maybe the last 2 decades. It's a For people who have come across patients with sickle cell disease, I think it's such a struggle for them in terms of both quality of life and maintaining a good health. So basically, what happens in sickle cell? We were talking about the red blood cell. You showed the picture of red cell earlier. If you go back to the previous slide, which highlights the say for example here. So here it's another example how the genes regulate a lot, and any changes that happens in the genes have a significant impact on our health. It's a In sickle cell, what happens is it's a very simple mutation. It's called as a point mutation, where one amino acid is being replaced with another amino acid, with which the functionality of the entire hemoglobin is changed. The oxygen carrying capacity is severely influenced, and when the oxygen levels go down, for example, when the body doesn't get enough oxygen, the cells, instead of staying circular and round, they become sickle-like you see in the picture on the right hand side. It
Mm-hmm.
looks like a sickle. It changes its shape, and when it changes its shape, it's not functional. And in the next picture, as you had the next slide, when these sickle cells go through capillaries, or small blood vessels, they clog the blood vessels, and that leads to a lot of tissue damage, be it brain, lungs, the fingertips, kidneys, almost all of the skin, almost all of the body organs which are dependent on good circulation have an impact by this process, what we call as sickling cell. And it's there are two main types of sickle cell disease. The mutations. Well, that's thalassemia, but in sickle cell, it's you have the straight sickle cell disease, or sometimes you can have a combination of beta thalassemia happening with sickle, what we call as sickle beta thalassemia. So when that happens, their hemoglobin levels go down because these sickle cells, which cannot stay in circulation, gets broken down as they're passing through the capillaries, and that's another type of anemia, what we call as hemolytic anemia. Um, and it's fairly common. I think it's most commonly seen among people with color. Here we see in the United States, we see among African Americans more, the sickle cell disease being more prevalent. It's as we grew up and studied in India, we have come across a fair share of patients with sickle cell disease in India as well.
Mm-hmm.
Africa, I think, is where it's more commonly prevalent. Um, Another interesting thing to keep in mind, a lot of people have sickle cell trait where only one of the gene is abnormal and the other gene is actually quite functional. And this is another important thing that we need to keep in mind, because many patients have sickle cell trait. Their hemoglobin might be slightly lower, but their phenotype, their health is not as affected at all, like people with sickle cell disease. Fortunately, the proportion of patients who really have sickle cell disease compared to people with sickle cell trait is much lower. And people with sickle cell trait, I would like to highlight, they likely will have a normal lifespan and really would not have any impact from having just one of the genes being abnormal. So sickle cell trait is not a bad condition to have. They might have smaller, a smaller size red blood cells and a slightly lower level of hemoglobin and hematocrit, but that usually will not have any impact on their health, and they go on to live essentially normal.
Hmm. What about in the US, most newborns have a blood test. They look for many genetic
Right.
conditions. So what is happening in India and other like the developing and the other part of the world, like Africa? So how do they come to know if they have sickle cell?
It's a great policy to have. It's really effective. You probably see, as a pediatric anesthesiologist, you probably come across younger kids. So with the family history or with the African American ancestry or Asian ancestry, and here I think even the Mediterranean ancestry, the screening for hemoglobinopathies is very uniform. It's a very simple test. I think in India, I don't think it's a general policy where everybody gets tested when they're born. But in quality institutions and academic centers, I think it's becoming more of a recommendation where they do a simple sickle dex screen, which can actually show us if there is a mutated or an abnormal sickling hemoglobin. When you kind of do a test with low oxygen levels and you see how the red cells respond. I think it's a very good policy because I'll spend a couple minutes quickly talking about the recent advances in sickle cell disease.
Yeah.
Diagnosing this early has huge implications, and the last decade has been all about how can we improve the quality of life, and as a matter of fact, even cure sickle cell disease. And like with any problem, identifying early on and identifying it accurately is the only way to treat it and even cure in many instances. So it's a great policy to do a neonatal screen for sickle cell disease. So like the examples I mentioned about if there's a family history, depending on their ancestry, depending on the geographical area they are from. So talking about the treatment, the advances in sickle cell, it's a proud moment in as a hematologist, knowing how devastating the quality of life it is for people living with sickle cell disease. There were, until maybe 3 or 4 years ago, the only uh, effective medication as such was hydroxyurea, which will actually convert the sickle cell, the bad type of hemoglobin, to the fetal type of hemoglobin, which carries oxygen better. But in the last 3 4 years, there's been newer medications, thanks to the science and research, where medications can actually improve the oxygen carrying capacity of the red blood cells. Medications can actually prevent the destruction, the binding of the red blood cells to the endothelium, which leads to the destruction. And these are, there are some pills, there are some infusions. More importantly, the role of transplant. I think that's what's changing the quality of life for these patients, younger children particularly. I think it's in the U.S. it's more of a standard of care now to do bone marrow transplant for younger children.
Mhm.
Adults, it's still a challenge because of they already might have sustained some of the end organ dysfunction. Some of the organs might have already been affected by sickle cell disease. So it may be a challenge to reverse those things, but it's still, when I see patients, young adults until age 30 or so, we still would recommend a bone marrow transplant. Gene therapy, I think it was until recently, it was something science fiction, but it's becoming a reality now. People have heard about technologies like CRISPR, where you can actually fix the abnormal gene. And sickle cell disease is a prototype where it's one single mutation, and it's easily, I wouldn't say a term easily, but at least by the prototype, something that we can work on fixing. And that's the future. There are at least 3 or 4 studies, real studies in patients, where they've been able to fix the gene, and that leading to normal production of normal hemoglobin. So there's a lot of fascinating research being done in sickle cell disease, and for once, I think we're making huge impact in how the quality of life will be for patients with sickle cell disease.
Hmm. So I do hope there is some treatment for sickle cell, because I do remember seeing a young patient when I was in Toronto who had what is called a sickle cell crisis, where they go through a lot of devastating complications, and
Right.
this unfortunately can happen in these patients. So
Yeah, it's very unpredictable how sickle cell crisis is the one, one of the medical emergencies these patients suffer frequently. It's very unpredictable, hard to predict when it's going to happen. Infection can lead to sickle cell crisis. Low oxygen levels can lead to sickle cell crisis. It can lead to respiratory failure. It can lead to renal failure. Pain is another one, which is very often seen in this patient's pain crisis. Vaso-occlusive, where the blood vessels get clogged severely by the sickle cell blood cells. Yeah, I think people who have seen them or taken care of them, we know how challenging it can be to take care of sickle cell patients.
yeah, now let's talk very briefly about thalassemia. So
Mhm.
what is thalassemia, and how is it different from other anemias?
So thalassemia is another prototype like sickle cell disease, where there's a single mutation that leads to impaired hemoglobin, basically. So, in one of the pictures, you showed that the structure of hemoglobin, it's a little convoluted chain of 2 different kinds of proteins, the alpha and the beta globins. And when there is a mutation either in the alpha, the gene that produces the alpha hemoglobin, or the gene that produces the beta hemoglobin, and that leads to the 2 types of thalassemias, the beta thalassemia and the alpha thalassemia. Again, like sickle cell disease, the thalassemias are the geographic distributions are variable. I think beta thalassemia is something that we see more commonly among the Mediterranean region, African Americans, also in populations from Southeast Asia. Alpha thalassemia is seen more in regions like Italy, upper Mediterranean regions. And again, like sickle cell, there is the 2 big categories: the sickle cell, the thalassemia trait, and then the thalassemia disease. The proportion of patients with thalassemia trait are much higher than, fortunately, less number of there's not too many people with thalassemia disease. And again, if you have thalassemia trait, I would like to highlight, your life expectancy will essentially be normal. You might have smaller than regular size red blood cells and slightly lower hemoglobin, but that really does not have any impact on the health. And here's a picture as you're projecting. It shows the different parts of the world of the occurrence of the incidence of beta thalassemia. Papua New Guinea probably has the highest incidence, close to 13%, and the different numbers in between.
Well, any hope of treatment for that?
Yes, yeah, there are some medications like sickle cell disease. There are some pills and infusions which actually improve the oxygen carrying capacity in the patients with sickle thalassemia disease. And again, like sickle cell, thalassemia can also be quite challenging. In younger patients, the recommendation is to consider an allogeneic bone marrow transplant early on, so that you can actually cure patients with thalassemia. Blood transfusions has been the mainstay for adult patients, and now there are medication infusions which can actually uh, make the hemoglobin more functional in terms of carrying oxygen. One thing that maybe I should have highlighted early on as an education point, blood has 3 kinds of cells: the red blood cells, white blood cells, and platelets. And as I mentioned, blood is the substance of life. Here, perfect. This is the slide. Red blood cells. The blood is overall is the substance of life. Without which life cannot sustain. And these three cells, the red blood cells, they carry oxygen. And the symptoms that we have been talking about related to anemia, be it iron deficiency or thalassemia or sickle cell, it comes down to the point that the body does not get enough amount of oxygen when the red blood cells are deficient. The white blood cells are our immune system. They are like the military of our body. They help us against infections and many other things. And platelets, those are tiny, tiny cells. I spent many, many years, half of my career, I would say, working on platelets and platelet disorders. As fascinating as they are, they can be very mischievous. They're involved not only in controlling the bleeding, but they can they're involved in a lot of other different things like inflammation, healing. I think people now have come across platelet infusions into the knees, for example, as a treatment modality for arthritis and skin regeneration. So there's a lot of potential with platelets, which I don't think we have realized yet.
Huh.
But the main function of platelets is preventing bleeding.
I did not know that.
Yeah, platelets are very highly potent and very energetic cells. They're good as long as they're not very active. Once they get activated, it's very hard to control them.
Okay. So sounds like a mouse. Well, if you're watching and if you don't find the anemia that you're suffering from, please do leave it in the comment section. We will get to it. In the interest of time, we'll just switch gears and move to, what is called as blood cancer or leukemias. So this is a very scary thing, and unfortunately, I do see too many patients actually having this problem. So the question is, why does one get it? And how can they prevent it?
Yeah, Raj, it's a very broad topic. I think maybe we can have another session about leukemias in particular. I think there is a lot of information and education that needs to be imparted to public about
Okay.
leukemia. So leukemia, it's a big bucket of different kinds of conditions. If you can highlight that slide that I had. Leukemia, basically what it means is leuko is white, emia is blood. When they have too many white blood cells in the blood, that is what we call as leukemia. But let me highlight this. Not every leukemia is scary. The most common type of leukemia that we come across, what we call as CLL, as you have it there in the left lower part of that slide, it's one of the most common types of leukemias. As a matter of fact, majority of the patients, I would like to say 90+% of the patients with this kind of leukemia, CLL, you'll be surprised to hear they don't need treatment. Actually, their life expectancy is essentially normal. And when I counsel patients, when I see patients with leukemia, particularly it's CLL, it's hard for them to believe when I say that you probably will pass away from something else than from leukemia. I usually like to use this phrase saying that you probably will pass away with leukemia rather than from leukemia when they have CLL,
Mm.
because it's a very indolent, very very low grade. It really doesn't do any harm to the body. It's just that an increased production of very mature lymphocytes in the body. So that's something I would like to highlight. When you hear the term leukemia, don't get scared. It's not all leukemias are the same, and not all leukemias are treated the same. So to put it in a very simplistic way, here's this picture kind of highlights. You have the chronic leukemias and the acute leukemias. What we really get concerned about, and what we the scare that we have patients passing away from leukemias, it's mostly the acute leukemias, and more in particular the acute myeloid leukemia, and also the acute lymphoid or lymphoblastic leukemias, which is AML is more common among elderly people, 60 plus, whereas the ALL is more common among pediatric patients, younger patients, probably within the first decade of life, even within the first year of life in many instances. So, yeah, I mean, yeah, again, as there have been so many advances in the field of medicine, I think the options for treatment are definitely becoming much better, even for the acute leukemias. In the current day and age, again, another thing which fascinates me as a hematologist, it's all about genes. It's all about knowing the genetics, be it what we are born with or whatever that happens in these cancer cells. Those are two different things. The genetic changes that happens in the cancer is not something that you're born with. It's something that these cancer cells, the cells acquire as they become cancerous. Um, what we now do is try to understand the specifics of each of these cancer types, each of these cancer cells, and try to predict how their clinical course will be. Also, fortunate that we have many medications which target those genetic mutations in the cancer cells, and more so in leukemias. We have plethora. We have many targeted therapies which specifically work on those genetic mutations. So I would I'd be very happy to, maybe we can, time permitting, we can have another session specifically talking about leukemias and addressing some of the educational points and information to public. But suffice to say that not all leukemias are the same. Please know that there is what we call as chronic leukemias and acute leukemias. Chronic leukemias tend to have a favorable prognosis, particularly CLL, where there's an increase in the lymphocyte count. Patients do have essentially a normal lifespan, and even in those subset of patients where they have to go through treatment for CLL, there are very effective treatments, pills, as a matter of fact, and monoclonal antibodies, which are more targeted to the cancer cells, very effective, and with very few side effects. So yeah, it's don't be scared. These leukemias also have a potential for cure.
Okay, thank you. That's reassuring to hear from an expert like you. Let's change gears a little bit more. So there is a practice in, I would say, India. This might be true for many other countries. You just pick up your phone, call a person in the lab, and then ask them to get every blood test under the sun because it's so easy to do without understanding what needs to be done and when it needs to be done. So the question is, what type of tests should people get it done from the lab? And I know it's probably hard to generalize because there are so many different tests, but from your perspective, if you want to educate the general public, so what would you say?
Well, it's a great point. Unfortunately, many of these things are becoming direct to the consumer these days, be it the genetic test or the battery of tests that they can, a laundry list of different tests, all under the, quote unquote, the test that will define their health. As a physician, and as a, somebody, I do a lot of community education and things like that. I do not see an instance where people can actually directly go to a lab and get a panel of tests done. I don't think it's probably a good idea, but as a general rule of thumb, if you have access to those kinds of things, the main things that you need to look for to maintain a good health, I
Hmm.
think it's only a handful. um, Something that, as 30 plus, 40 plus, and 50 plus, particularly when you cross that age mark, 50 plus years of age, I think the most important thing that we need to look out for is the blood glucose level. um, Important to look at the kidney functions, more important to look at the cholesterol levels. I think these three main things actually have a huge impact on our health in the long term. um, Thyroid function test is another thing which I would recommend getting checked, maybe on an annual basis, or depending on the symptoms, if not regularly, at least once when you have a physical exam at age 50 or whatnot. But beyond that, the clinical utility of doing a battery of tests has not proven or shown to be effective. I would not encourage to just doing these tests yourself, going to a lab. I do come across these instances in India where you have labs everywhere. Every street corner has a lab, and They have a health exam laundry list of tests that they offer. Um, I do not see that to be clinically beneficial for patients, and I strongly recommend not to do those kinds of things. And like I said earlier, if for maintaining good health, there's only a few handful of tests that are required, and the ones that I just mentioned. But if you have symptoms, definitely seek out help. If somebody, a physician that you see, or a healthcare provider that you trust. And I think a timely intervention, timely knowing there are, one might say maybe we should have diagnosed this early. Not all diseases do manifest, at a certain of time. Early is, it's a very broad spectrum. It could be 1 year, it could be 10 years, it could be 20 years. So that becomes a little, not very clear. So I would say when you have symptoms, definitely seek help right away. But don't do a battery of tests that a lab offers to you. Always seek advice from a physician or a healthcare provider before doing multiple tests. It's not advisable. It's not helpful.
Yeah, don't spend too much money on things like this, but rather spend money on buying healthy stuff and you know do
Yeah.
some physical activities.
Yeah, yeah. One thing that, if I may highlight, I know we might be running a little close on time. The genetics, right? We have many, many genes, and what we are born with, even if there is say, a tiny defect in one of the genes, that may not always manifest as a disease. So that's something really important to know. um, we have these very sensitive tests these days where you can test the entire genome. As a matter of fact, I think a lot of lab companies are now reaching out to the consumers directly for doing these genetic testing, and you come across some genetic abnormality, some unknown genetic abnormality. For example, unknown, I mean not clinically relevant abnormality, and that can kind of take you on a different journey. You're now diagnosed with a condition which, or you've now found out with a condition, genetic condition, which may not really have any implication to your health as such. So it may not be necessary to really do those kinds of very sensitive tests unless you have a strong family history or symptoms or something that suggests an illness going on. So I would always encourage to have a counseling either with your physician or with a person that you trust in terms of your health. Again, stay away from search engines like particularly for health. Google and web search engines. It's not they really do not provide you good advice about your what kind of testing should be done or what conditions are you really dealing with. Always talk to a physician or a healthcare provider.
Great. So this is the unfortunate era of COVID. So we can't do anything without touching COVID. Initially, there was initially there were some talks about some blood groups having a high risk for COVID. Is that true?
Right. Well, yeah. Initially, when everything was very chaotic, when the COVID pandemic started, everybody was trying to do some research, try to understand, try to predict who are at higher risk of developing COVID. I think a couple of things. Maybe the Chinese studies and a couple of Italian studies had shown maybe A positive might have a higher risk of developing COVID, and O, blood group O, might have a lower risk of COVID. But I can tell you a large study which was just published earlier this year in April. Is my volume still okay? You're able to hear me?
Yes, yes.
Yes, yes. Okay, good. So this actually has not panned out. It's not. This is completely a myth. In the United States, we had a large study just published within the past 4 to 5 months. I think April or May of 2021. A data set of about 120,000 patients, which showed that the blood group absolutely has no association predicting the outcomes or the risk of infection. Who would develop or who would have a higher chance of contacting COVID. So the myth has been busted. There is no association between the blood group and the risk of COVID infection, or even the severity of the infection that one would have from COVID infection. So no association. So we can clearly make the statement that there is no association between the blood group and the COVID infection.
Okay. That's fantastic. And what do you think of vaccines in patients with cancer and those who are immunocompromised? Should they
Yes.
be getting, and what do you think of booster?
Yes. So good questions. Another thing that we just published this paper within the last couple of weeks, looking at some of the impacts of COVID vaccine, particularly in my area. Talked doing about research in platelets. There is a little bit of a risk of lowering of the platelet count, or in some patients developing blood clot. And again, I would like to highlight this is not a reason not to get vaccine. Maybe I should use this platform and another opportunity to encourage everybody to get vaccine.
Hmm.
There is more and more reasons to get vaccine. In the first 6 to 7 months of this pandemic, and as a matter of fact, even after the vaccine became available, in my practice, seeing a lot of patients with cancer and immunocompromised states, we were a little worried what's the benefit of, since their immune system is a little lower, would they really be able to mount a response to the vaccine? I think we've gone past that. We are recommending COVID vaccine for all of our patients. And within the last week, here in the United States, CDC has made a statement that patients who have cancer and going through treatments, who are actively on treatment, and people who have immunocompromised states, people who have gone through bone marrow transplant or solid organ transplants within the bone marrow transplant, particularly within the first 2 years where they are on immunosuppression medications, people who have combined variable immunodeficiency, where their immune system is not very effective, these are the patients who should be getting a booster vaccine. And let me highlight, booster vaccine is not, at this time, not recommended for everybody. It's only recommended for people who have a little less functioning immune system. And there is a list that the CDC actually, has prescribed as to who would come under the category. It's a changing area. It's an evolving field. I won't be surprised another 6 months or a year down the lane, knowing what happens to everybody's immune system, and the variations of the virus that might come around. Everybody might have to get a booster, but at this time, I would like to highlight the booster is only for patients who have less than normal functioning immune system.
Hmm. That was great. So, Prakash, there is a question from the audience from Sudeep KH, which says, can untreated childhood illness like anemia cause epigenetic modification, causing later onset malignancies or other illness?
That's a great question. It's a very deep question. So, thanks for the question. Um, yeah, anemia in childhood can be due to many different reasons. I think there are certain genetic conditions. I think there is one called Fanconi's anemia, which is probably one prototype, anemia during childhood, which has a higher risk of developing malignancy in the later part of their life. There are certain genetic, there are similarly like Fanconi's anemia. There are other anemias which have a higher tendency of developing leukemias or other solid organ cancers in the future, kidney cancer in particular. Sickle cell disease is another example. For example, since we talked about it, it does lead to some associated epigenetic modifications. What that means is uh, not just the main gene, the structures associated with the gene that kind of keeps the gene stable, be it in a packaged form or something that leads to the functionality, when the gene gets expressed. Those those components of the gene can be modified, and those are now known to be one of the causative or the causal things for developing cancer down the lane. Fortunately, there are not many of them. There are a few handful of those. I think maybe there is more to be learned about these conditions, and again, if there is a treatment, this might be another indication, another reason why, if we can fix some of these conditions early on, we can not only provide good quality of life, also prevent certain things that can happen later on in their lives.
Hmm. Thank you. So, Prakash, this was so educative, and I have to really thank you so much for being here. I do have to be respectful of your time. It is It was so fun talking to you.
Absolutely, Raj. It's a great pleasure. It's I've been a fan of your programs and I've watched all of your videos. It's a great way of
Thank you, sir.
reaching out to. I think this is one perfect way of utilizing the social media to reach out to the people and educate. There's plenty of things that people we can always educate more about, and it's a great opportunity. And I look forward. I'm very happy to be part of this program and look forward to be part of it more in the future too, as time permits. Thank you, Raj.
Thank you. So I have to say one final thing. We both are doctors. So I am vaccinated. Prakash is vaccinated. This is because we strongly believe that's the right thing to do based on science. Whatever the other discussions is, whatever anyway, I don't want to get there, but the right thing to do is get vaccinated. So we strongly encourage you, if you're eligible, to get vaccinated for COVID.
Yeah, not only adults, even kids. Children should be vaccinated. I think right now, age 12 plus, everybody is getting, is able to get the vaccine. Yes, I can't agree more with you, Raj, that we all should get vaccinated. I think that's the only way that we can change the natural course of this disease. At least, have a chance at changing the natural course of this disease.
Yeah, yeah. Well, thank you so much.
It's a great pleasure, and thank you for having me, Raj. It was a great conversation.
Yeah, take care. Bye.
Yeah, you too. Yeah, bye, everybody.
Bye.